Circulation. All cells of our body require constant nutrition and waste removal since they are metabolically active. Most of the body cells are located at some distance from the nutrient sources such as digestive tract sites, waste of kidney disposal, such as kidneys, the cardiovascular system, which consists of the heart, blood vessels, and blood, connects the various tissues of the body. While the heart pumps the blood through the blood vessels, the blood delivers nutrients and collects waste products. Functioning of heart. Heart is a pumping organ. It receives blood from different parts of the body through the veins, open through inferior and superior vena cava and pulmonary veins. While the right atrium receives deoxygenated blood, the left atrium receives the oxygenated blood from the lungs. When the walls of the atria contract, the right and left atria pump the blood into the right and left ventricles respectively. A pulmonary trunk arising from the right ventricle takes away the blood to the lungs for oxygenation. The left ventricle gives rise to an aorta from which oxygenated blood is supplied to the coronary arteries and the systemic circulation of the body. This is the structure of human heart. This is aorta, pulmonary veins, left atrium, semilunar valve, bicuspid valve, left ventricle, right ventricle, inferior vena cava, tricuspid valve, right atrium, pulmonary trunk, superior vena cava. The blood flow between the right atrium and the right ventricle is regulated by tricuspid valve. The bicuspid valve or mitral valve regulates the flow on the left chambers of the heart. In the pulmonary trunk and the aorta, backflow of blood is prevented by a set of semilunar valves. Origin and conduction of heartbeat. During pumping action of heart, the heart muscles cause rhythmic contraction and relaxation of the heart chambers on a specific sequence. The rhythmic sequential functioning of cardiac chamber is maintained by sinoatrial node (SA node), atrioventricular node (AV node), bundle of health and Purkinje fibers. Sinoatrial node, atrioventricular node, bundle of His, Purkinje fiber. کله چې دا خراب شي کنه نو په دې کې بیا آرټیفیشل پیس میکر لګي او آرټیفیشل پیس میکر چې 10 ایئرز پورې کار ورکوي میټرونیک کمپنی دی یا زیات دی د استرالیا امریکا اټلی د دې ناراضي او هغه بیا کار کوي چې کله هغه بیا بیټریز ختم کړي نو هغه بیا ریپلیس کیږي او یا ریچارج کیږي. The SA node situated in the upper lateral wall of the right atrium is a small flattened strip of muscles fiber that is 1.5 centimeter multiplied by 3 millimeter in size. The fibers of SA node are closely associated with the muscles of auricles. SA node is capable of generating action potential that can travel throughout the auricles. The velocity of conduction is 0.3 meter per second. The excitation from the SA node stimulates the AV node. The AV node in turn conducts the stimulus to bundle of His or Purkinje fibers. These myocardial fibers are found all over the wall of the ventricles, and the conduction of stimulus through the AV node and the fibrous system there is a delay in transmission. Cardiac cycle. The sequential events occurring from the initiation of one heartbeat to commencement of the next is called as one cardiac cycle. In this cycle, the contraction phase is called systole. The relaxation phase is the diastole. A single heartbeat comprises a systole and diastole in both atria and ventricles. Atrial systole, there is a continuous flow of blood into the right atrium through superior and inferior vena cava and coronary sinus. Simultaneously, the left atrium receives blood from four pulmonary veins. There is a passive movement of nearly 70% of the blood. The remaining 30% is pumped into the ventricles by atrial contraction, ventricular filling. When the values in between atria and ventricles open, nearly two-thirds of the ventricle is filled. Remaining space gets filled by atrial contraction. Ventricular systole. As the atrial systole ends, the action potential generated by the SA node reaches the AV node and rest of the fibrous system at constriction of the ventricular wall. Thus, ventricular pressure results. The very strong ventricular pressure pumps the blood into respective arteries by causing the semilunar volutes to open. Ventricular diastole. Soon after the blood leaves the ventricle, there is a fall in the ventricular pressure. The semilunar volutes close and the arterial volutes open to begin the next cycle. Heart sound. The heart sound felt by a stethoscope is caused due to closure and opening of the volutes. The generation of sound is rhythmic. The first sound is louder lub and of longer duration 0.16 to 0.90 second. It is due to closure of the atrioventricular volutes at the beginning of the ventricular systole. The second sound is of shorter duration dub 0.10 second. It is caused at the end of the ventricular systole by the closure of semilunar volute. The heart beats at the rate of about 72 to 80 times per minute in adults. The ventricular systole causes a wave of distension due to blood flow. It is called arterial pulse. It can be felt on the wrist. The pulse rate corresponds to rate of heartbeat, coronary blood vessel, and its significance. There are two main coronary arteries, and the left and the right. The left one branches into the left circumflex artery and the left anterior descending artery. Right main coronary artery and the left coronary arteries branch up from the aorta, surround and penetrate the heart muscle, arteriole and capillaries. Branch up from the coronary arteries to supply heart muscle with oxygen. Rich blood, deoxygenated blood drains into the coronary veins, which carry it back into the heart's right atrium. Damage the coronary blood vessel or narrowing of the coronary vessel leads to coronary artery disease. Blood flow through the arteries is restricted, leading to damages of heart muscle. Heart disorders like heart attack, myocardial infarction, the chest pain, or angina are usually caused by, in many parts of the world, mortality from coronary myocardial infarction. Myocardial infarction is a coronary artery disease which involves sudden death of part of the heart muscle due to blockage in the coronary artery. It may cause severe, unremitting chest pain. Causes. The coronary arteries that supply the heart muscle with fresh oxygenated blood become narrowed. This narrowing is usually due to an accumulation of droplets of fatty substances like cholesterol. The fibrous cover of the fat deposit sometimes rupture, triggering the formation of a blood clot. If this blood clot blocks the artery, blood flow to an area of the heart muscle stops, causing myocardial infarction and leads to dead tissue. Symptoms. Severe heavy crushing pain may spread up to the neck into the arms, especially the left arm, sweating, shortness of breath, nausea, vomiting, anxiety, sometimes accompanied by fear of dying. About 1 in 5 people experience no chest pain in myocardial infarction. However, there may be fainting, sweating, and pale skin. This pattern of symptom is known as silent infarction. This type of infarction is common in people with diabetes mellitus or those with elevated blood pressure. Risk factors. Habitual cigarette smokers have a substantially increased risk of dying from myocardial infarction. High blood pressure is a major risk factor, and the risk increases with higher pressure. The risk of atherosclerosis and coronary artery disease increases dramatically in those who are more. Raised blood cholesterol level increases the risk. Physical inactivity is also a major factor. Angina pectoris. Angina is a term that is subjective to pain. Angina can become heart disorder called angina pectoris. This heart disorder refers to chest pain caused by insufficient supply of oxygen to the heart, usually a result of poor blood supply. Angina when the demand for oxygen is increased during exercise and at the time of stress. The pain usually comes uncertainly. The pain ranges from a odd to intense. It lasts for 30 minutes or more and is not relieved by rest. Causes inadequate blood supply to heart due to coronary artery disease such as atherosclerosis to severe attack, polycythemia, increased number of red blood cells that thickens the blood, causing it to slow its flow through the heart muscle. Toxicosis can precipitate angina pectoris by making the heart work harder and faster than its blood. Angiogram, X-ray, can be used to detect an abnormality in blood vessels such as lapping of a large diseased artery. Coronary angiography. Coronary angiography is caused to image the arteries that supply heart muscle with blood. Angiography can image narrowed or which are not visible on a normal X-ray. A local flexible catheter is passed within the artery through the aorta and into a coronary artery. A contrast dye is injected through the catheter and a series of X-rays. The procedure is painless. Coronary angioplasty, main important step for heart disorder. Coronary angioplasty is an operation done to clear flow of blood when the coronary arteries are narrowed or blocked by fatty deposits. With the help of a balloon catheter under local anesthesia, a guide wire is inserted through the femoral artery. Affected coronary artery, a balloon catheter is passed up the wire and the balloon is a tube called a stent is inserted afterward. It keeps the artery open. Coronary bypass surgery, difficult task, is an operation to circumvent narrowed or blocked coronary arteries by grafting additional blood vessels to transmit blood flow. During this procedure, the heart is temporarily stopped and blood circulation and oxygenation is taken heart-lung machine. Atherosclerosis. Atherosclerosis is narrowing of the arteries caused by plaques on their inner linings. Their plaques are composed mainly of fat deposits. that disrupt the normal flow of blood through the affected artery. Atherosclerosis encourages thrombus and embolus, fragment of blood clot. Men are affected earlier than women because women are protected by hormones causes. A fresh patch is called flax. These flax consist of a stroma, fat, and oil mixture. Decaying muscle cells, fibrous tissues, clumps of blood platelets, cholesterol, and blood clot. Risk factors: cigarette smoking, hypertension, maldiet, obesity, physical inactivity, diabetes mellitus, heredity, aggressive personality, severe effects of atherosclerosis, a stroke, loss of blood supply to brain, heart attack, loss of blood supply to heart block, complete failure of heart system that conducts electrical impulses from the upper to the lower heart chamber as per the heart block. Normally, from the sinoauricular node to the atrioventricular node and the right extreme and then to the ventricle. In complete heart block, the impulses cannot reach the ventricle. Thus, defective sinoatrial impulses and its conduction in the heart is called heart block. Echocardiography is a technique that uses ultrasound waves to analyze the beat of heart. This is usually done by using an ultrasound transfer probe placed on the skin of the chest directly over the heart. In some cases, a small probe is passed down the esophagus. Heart valves. Heart valves are essential for controlling the flow of blood in between auricles and ventricles and between the heart and major blood vessels. Valves are delicate pockets and their function is to prevent any backward flow of blood. The heart valve's functioning is for efficiency of heart as a pump. The opening and more particularly the closing of heart valves during each heart cycle are responsible for heart sounds. Any of the four heart valves may be affected by stenosis, narrowing, which causes the heart to work harder to force blood to the valve. Incompetence or insufficiency, likeness, makes the valve unable to prevent backwash effects or characteristics heart marred by adduction. Rheumatic heart disease. It is a common form of disease found throughout the world. RG as a condition is caused by the immune system attacking the body all tissues in response to the may include high fever, pain, intensive coronary care unit ICU. All major hospitals in urban towns and cities have intensive coronary care units to care for people in a critical or unstable condition. They require continuous monitoring. This unit has a wide variety of sophisticated equipment for constantly monitoring the condition of the seriously ill patient. The patient may be connected to a ventricular to maintain blood sugar levels are maintained by intravenous infusion of salts and glucose.